Hi, yes, we're fielding a slightly different team from this morning, as many hits are. So the Shine hit is about, it says that they're supporting healthy, inclusive neighbourhood environments. And what we're doing is looking at the, if you like, some of the non-NHS professions and what they can do to support health. So we're interacting with transport planners, architects, urban designers, landscape architects, etc. And the work of the HIT is very much connected into neighbourhoods, and Ben has been supporting our work. Ben, who's on the leadership group, has been supporting our work wonderfully in that sort of connection. The HIT has two aspects to it, the way to conceptualise it. There's places that people move to through the city, and that might be through cycling, it might be through walking, it might be through car driving, it might be on public transport. There's a sort of linear bit to it about moving, and then there's about place as well. Places people live, places people work, places people have leisure activities. There's sort of those two aspects. And I just wanted to illustrate it, something I didn't say this morning. I cycled in today to the conference, and I've been recently in Barcelona and in the Netherlands, in all sorts of situations, and also in the States, looking at cycling in cities. And here I was faced, as a cyclist, I'm on the same routes that freight is using. Like, unbelievable. Through the city centre, we have freight going through our city centre, where there's people moving about, there's children, there's old people crossing the roads. I haven't faced that for a number of weeks now, because I've been in cities, not even in Barcelona would they have freight going through the city centre. There's big lorries next to me. And then I pitch up here in a rainy climate, and at this, lavish place here, I'm parking my bike without cover. So you've got two aspects. You've got the danger of the freight vehicles, and then you've got the sort of, does it feel pleasurable to be cycling? And I might be going out in the rain and fumbling with my lock and that I'll be drenched while I'm doing that. If we were designing a system to suppress cycling, we couldn't do it better, quite frankly. So just moving on to the presentation. So Ben will talk about the walking work. So we've got 4 directors, and Susan Audrey, who isn't here. Adrian had to leave early, and I'm sort of holding the ball here. But Ben's been working very closely with Susan Audrey on the cycling work. So do you want to, on the walking work. Do you want to talk?
We've
about
been
that. In fact,
running. I'm a retired person, and I work mainly in the Bedminster area doing community development work. I have been doing that since I retired about 20 odd years ago, and it's great fun. Better on television. One of the projects that we've been working on for quite a few years, but especially last year, was the Let's Walk Bedminster project, where we got some money from the City Council, from the Green Capital, to develop walking in the area. Most parts of the city, most parts of Bedminster are perfectly nice to walk about, but there are some parts which are discouraging, if you like, for walkers. From a health point of view, our assumptions are that taking exercise is healthy. That's a general proposition. That walking is cheap, relatively easily done, doesn't pollute the atmosphere, and so on and so forth. So as a means of exercise, there's a lot to be said for it. But in terms of, as Marcus has indicated, in terms of the sort of hierarchy of what happens in terms of power, walkers are very often at some disadvantage. Trying to put that right, give me £5 or £6 billion and I'll restructure the city, but that's an unlikely outcome. So we were given a small sum of money, and we passed some of that sum of money on to a number of community organisations within our area. And we said to them, look at your street, or possibly a series of streets, that people might use on a daily basis to go to school, go to the shops, visit their friends, pop down the park, whatever it might be. Do an analysis of that street. What are the pluses and minuses? And if you had a small sum of money, and I'm talking small sums here, the smallest sum we gave out was £207. The biggest we gave out was, I think, 4 or 5 grand, and that was for quite a large scheme. come back to us with an analysis of the street and proposals for putting it right. Now, what they did was not rocket science, very basic things. If, for example, your street has got bins permanently parked on the pavement, or cars half up on the pavement, or other sorts of obstacles, then you don't need to be, you don't need a £250,000 research grant to suggest that that is discouraging as far as walking is concerned. Of course, it's also very unfair to people who find it particularly difficult to walk. Older people, possibly, people with mobility problems, people with sight problems. The RNOB, for example, are currently running a national campaign about obstacles in the street called Who Put That There? So you can see that if you wanted to go out and you were disadvantaged in that way, you might well think twice about it. On the other hand, there may be features of your streets which are very positive. There may be nice trees. Oh, I haven't finished yet. There may be nice trees, or there may be front gardens which are attractive, or a whole range of other things. And again, what we've been trying to do is to encourage people to work much more on those sorts of things to up them. So find the things that you don't like, and we'll try and get rid of them. Find the things that you do like, and we'll encourage them. Obviously, there are things which, as for those small sums, you can't do. But there may be, for example, a difficult road to cross. You want me to shut up?
In a minute.
If it's a zebra crossing, you're talking 20 grand. Okay, we can't do that, but we could at least press the council for doing that. So it's very much small scale, bottom up, small interventions involving people, rather than somebody up top deciding things. I'll shut up.
No, that's very good. And on top of this work, a Bristol Walking Alliance has been set up, and the Shine Director coordinating it is Suzanne Audrey, and the slide before was some of the work she's been doing on an NIHR-funded trial now, looking at walking to work through employer-supported schemes. So that's a body of work that we're doing. Going on to Adrian's slides that he was presenting, we've been talking here a lot about the evidence base and working with the council, working with professions that aren't public health professions. The scientific evidence is one small part of the different inputs, if you like, into their world on which they base decisions. There's politics and ideology, and there's pragmatism, business as usual, and traffic professionals doing what they learnt in their first diploma, 20, 30, 50 years later, they're doing the same. So there's a different CPD even in this that isn't so evidence-based. In order to place evidence in their worlds in a much more assimilable way, Adrian every week produces a simple one-pager where he unpacks a really good piece of scientific evidence on a single page, dejargonized, for the transport fraternity to make decisions on. And these are called essential evidence on a page, and they're stacking up now because we've been doing it for a number of years, 142. Really useful, and they're being used sort of nationally. I've been picking up now the place-based work, so we've got that sort of linear moving, the place-based work, which also Ben's been involved with in the past, asking communities what's keeping you healthy and what's detracting from health in the place, and not just about walking and moving. And these are we had an event, and these are some of the issues, criteria that have come out of the event. So we'll be developing with communities and with the evidence base some sort of coherent neighbourhood checklist that might lead on to neighbourhood awards, like Healthy Neighbourhood Awards, bronze, silver, gold, that neighbourhoods might go for. In not as being the healthy neighbourhood, but in we know about these issues. So it's a sort of like a health lens, health impact assessment, making people aware that they can do things in their neighbourhoods for health. And the investment, the money, is coming in through neighbourhood partnerships. There's often changes in the neighbourhoods happening. The other big strategic envelope, big strategic context is big documents like this that will actually set the pattern for housing and transport in the whole of the West of England region for the next 25 years. And we coordinated a response, an evidence-based response across a number of hits, and fantastic for all the hits that that put their evidence in, and we were able to give a coherent health message. And you can see that David Relf has signed off an introduction to this, putting a place marker for health in spatial planning across the region. So very much involved in sort of non-health service. You can see what I'm getting at. It's non-health service delivery stuff, but stuff that's so important to environments and healthy environments. Thank you.